Let's see what exactly is orthodontics. In 1922, the British Society for the Study of Orthodontics has defined the specialty as orthodontics includes the study of the growth and development of the jaws and face, particularly, and the body generally as influencing the position of the teeth. The study of action and reaction of internal and external influences on the development and the prevention and correction of arrested and perverted development. Unfavorable sequelae of malocclusion, poor facial appearance, risk of caries, predisposition to periodontal diseases, risk of trauma, and temporomandibular joint problems, psychological disturbances, abnormalities of function, aims of orthodontic treatment. The aims and objectives of orthodontic therapy have been summarized by Jackson as the Jackson's triad. The three main objectives are functional efficiency, structural balance, and aesthetic harmony. Now let's see the three parts. What exactly is functional efficiency? Many malocclusions affect normal functioning of the stomatognathic system. The orthodontic treatment should thus aim at improving the functioning of the orofacial apparatus. Structural balance. The orofacial region consists of the dento-alveolar system, the skeletal tissue, and the soft tissue including musculature. Stable orthodontic treatment is best achieved by maintaining a balance between these three tissue systems. Aesthetic harmony. By far the most common reason for seeking orthodontic care is to improve the appearance of the teeth and face. Many malocclusions are associated with the unsightly appearance of teeth and thus can affect the individual's self-image, well-being, and success in society. Thus, the orthodontic treatment should aim at improving the aesthetics of the individual. Thank you.